welcome Gwen Miller, and thank you for agreeing to do an interview with me today about your life, which is an inspiration to me, your work, and hopefully will be an inspiration to my students and clients. And so today I'm going to interview you about a few things. And the first one I'd like to know about is what brought you to where you're at today? What's your journey? And if you want to start with just sharing what's your work to begin with, where are you right now? What are you doing with your life that might be of interest to others? And then how you got there.
Okay. Well, today, my work, I think it's probably three main things. I'm an educator for Balanced Body Pilates. So I teach people who wish to become Pilates instructors, take them through a very good comprehensive curriculum that was designed by Nora St. John. And I teach continuing education for yoga, Pilates, and strength training professionals and massage therapists, anybody who's working with bodies in how to work with spinal pathologies and hip and sacral issues, bone and joint issues, basically. And this is based on my book. So the third thing is I'm an author. My book is Safe Movement for All Spines, a guide to spinal anatomy and how to work with 21 spine and hip conditions. And that book was published in May of last year. It's already in its second printing. Pretty happy that it's been on the Amazon bestseller list for sports injury prevention and osteoporosis and pain management for the entire time. It's extraordinary. It's just been a real grassroots growth and very steady word of mouth, a lot of word of mouth. But that's what I do now. And so I'm teaching, I'm traveling and teaching, and I work with individuals doing what I call integrated therapy. So I combine yoga therapy and strength training, Pilates, whatever the person resonates with, along with Hendrickson method manual therapy to help people find a pathway to move away from pain and into a more fulfilling life, returning to the things that they love to do that maybe have been interrupted by either chronic or acute pain. So that's my mission. And what got me here is at the age of 40, I found a time in my life where I was not happy with my life, and I decided to change my life. And so I lost quite a bit of weight and began to exercise under the guidance of a personal trainer. Decided that I wanted to help others to become happy in their lives, one of the Joseph Pilates sayings is you're only as old as your spine. Physical fitness is the first requisite of happiness. There's lots of quotes about how when we are free of the bondage of a body that's not working the way that we need it to, we can really fly and we can, rise above that. And so I worked very hard to regain my own health and wanted to help other people. And so that motivation to help other people has been with me all of this time. It is the reason that I've spent over 2 decades studying, researching, working with what we call special populations, finding ways to navigate pain and to navigate situations and diagnoses or any situation that is limiting people from really living the way that they want to. So that's why I wrote the book. People started asking me, when are you going to write a book? And I finally had enough people ask me that. And I said, okay, I guess it's time to write the book. So spent a few years doing that. And so, at this point, I'm really, my main focus, aside from my, private practice, is to help educate and empower teachers of any modality to be confident in working effectively with people who have spine and hip and joint conditions, that we can do more than we think, and with the assurance that we have the guidance of kind of like what to do, what not to do, but going beyond things like a this for that programming, going beyond like, oh, for this condition do this yoga pose, or for this condition do this exercise, really facilitating a way to think and problem solve that will allow the person to transcend a pose for condition type of training, so that we can be brilliant in our own creativity when we're working with people. So that's what I'm doing now.
Awesome. That's amazing work. I'm so excited to be working with you soon in our upcoming workshop series about pain.
Me
And
too.
yeah. And so you got into this a little bit, but I'm just going to ask a little bit more about like your why you do this, what's your inspiration. You've already spoken a little bit to like seeing the transformation in your life and really wanting other people to have the fulfillment they want in their lives. Is there anything else you want to add to that about what inspires you?
Well, my inspiration is my family, friends, my ancestors, and every single person I've ever worked with, whether they are a client or a student. I have found that everyone who enters my life is there for a reason. And, that sounds kind of like that's an old sort of a kind of almost trite, but I really have found it to be true that, my inspiration in educating about osteoporosis, for example, comes directly from my grandmother, who was diagnosed with osteoporosis in her 70s. They didn't know much about it then as much as they do now. She was told to exercise, and she literally had a pedometer on her waistband, counting her steps, like everything that she did, thinking that that was going to help. And it didn't. And more information has come out since then, but she was prescribed pain relievers that have now been shown to be calcium absorption blockers, and ended up dying at 93, but she would have lived much longer. I had a really loving adult relationship with her until I was in my 40s, and I'm very grateful for that. She died in a lot of pain because of the progression of the osteoporosis that finally just made her breathing difficult, so she wasn't able to breathe properly. My dad had a disc herniation and healed it with exercise, refused surgery. Now, I'm not saying I'm against surgery, because sometimes surgery is warranted. And I feel like my role is to really guide people in making their own decisions, to give them options. So just wanted to insert that. But then every single student that I have who has a client, every client who's walked in my door with something that nobody could figure out, and I had to do tons of research, they're all inspirations. In fact, I find that I have one, maybe two, people come into my life that I call my muse, and they become my muse for research. They inspire my curiosity to do the research and to practice, and to help. So they're all my whys. And my why now is, let's get this message out to a wider audience. People have a diagnosis, or they have pain, or they have something occur, their bodies change, and they become sometimes afraid to move, and movement actually is what we need more of. And if we're afraid to move, I mean, we all have heard this downward spiral of arthritis, right? Someone gets arthritis and it hurts to move, so we move less, but yet arthritis, especially osteoarthritis, needs movement. Our joints need movement for the circulation and the lubrication in the joints. So if we move less, the situation can become worse because we're lacking that circulation and lubrication effect that movement gives us. And so it becomes a downward spiral. But to know like how to move, like to actually renegotiate, what does movement mean in a body that has changed in some way? That's really the key to removing the fear of movement. So, and I think that our population of teachers, we're all healers. We're in this position where we can help educate other teachers to be able to explain and then to develop programs that are individualized for our clientele so that they can feel successful and confident in continuing to move.
Great. Yeah, thank you. And you mention some of your specialty, but is there anything else you haven't said about that you would like to, anything that you really feel like right now in this moment, you're leaning into or you're passionate about?
Well, so basically the working with people, and again, this sounds like one of these trite sayings, but meeting them where they are. I mean, I work with people who have scoliosis in their spines, people who have hypermobility in their bodies, people who have hip, sacral, and spine conditions where they're either uncomfortable in extension or uncomfortable or maybe contraindicated for flexion. I mean, all of that is, every person that I meet, it's, everyone's different. We all have a spine, we all have muscles, but, inside we're all the same, but yet we're all individual, we're all unique. And so that to me keeps me very interested and engaged in what I do. And what I've been really kind of meditating about is this idea that everybody that I work with feels somehow at some point almost trapped in their own body. Like if you have a condition where you're not supposed to forward flex from the waist, right? So discs or osteopenia or porosis, right? I mean, you're kind of like trapped into that movement pattern, but there's way more that we can do, and it's not really all true. And so, depending on whether someone has a spinal fusion or has just gained a lot of weight, that's another way someone can be trapped in their own body. And so it feels almost like now I feel like there's sort of this transcendence of going beyond the purely physical, and looking at like what is it that we can do in order to free that person free their physical body so that their spirit can be like more able to do what they're supposed to be here to do, you know. So that's kind of been inspiring to me, and it's just been also kind of a similarity, a thread of similarity that I've been noticing. So I don't know if that makes sense.
Yeah. No, I love how you put things. I think it's very well said. And we'll be wrapping up here in a minute, but I do want to know if there is a success story you can think of, somebody who was in chronic pain, who was feeling trapped by their body, perhaps, that you've worked with, either in person or virtually in any of your different ways you teach, that you think would be interesting for our listeners to hear about.
Yeah, well, I will share more about this in our first session, but I'll just give you a little preview. It's Susan's story is the first case study that I'll be discussing in our first session, and she was one who had chronic pain for years, and by using very simple techniques and progressions, I was able to figure out what was the pain generator, affirm and acknowledge for her that her pain was real, because this is also a case where we were looking at some gaslighting going on, unfortunately. She was basically being handed pills and sent to pain management. And, while there's a place for that too, it's sometimes, unfortunately, the experience of people that I've worked with that there's not a lot of holistic viewpoint going on medically. That is changing. I'm happy to hear it. But I met her, I found what her positions of comfort were. And literally, our first sessions, I would just sit beside her when she finally was comfortable. And the relief of not being in pain in that moment was so great that she would just cry, and I would hand her Kleenexes. And that she has progressed to being able to maintain her own spine condition, and being able to, she understands what exercises to do. We have an SOS program for her. So if she does feel something like we identify the danger signals, we all have them. Um, and so she is able to, live a normal life, where previously the pain was pretty debilitating. So she's actually, I wrote her up in my book, but I can share more specifics in the course. And she's given me permission to do that for the educational purposes. So yeah, that's it's pretty amazing. And we'll also go into, like, in our first course, like the differences between chronic and acute pain and how they're different, and how we can deal with that. This is something where holding the space for someone is really important, when they come to us, when they trust us and they're vulnerable to reveal that they're having discomfort. Yeah.
Well, thank you so much for letting me interview you. And our workshop series, Science, Anatomy, and Yoga Philosophy for Chronic Pain, is happening this month, starting April 17th. So I will see you again on Zoom then. And
Yeah, I'm super excited about that, Sierra. This is like a dream, because my first love was yoga, and I've just had this dream of like, how do we, put the chakras, the energy centers of the body, how do we map that with the nervous system, and what does that mean with regards to pain and chronic pain, and yeah, it's just, this is like the dream course to teach, really, for me. I'm super excited about exploring all these ideas with you and with the people that we'll be working with.